Good morning, and thank you for taking the time to join us for the PQMD special COVID-19 Pillar Talk webinar series, which is made possible in part from a generous contribution from Pfizer. Today, PQMD has partnered with Global Water 2020 to bring you an amazing group of thought leaders who will share their insights about WASH and health systems resiliency. This is the first ever of a two-part panel for PQMD. So we're really excited to spend this time with you today. I'm Julie Marie Vanderberg. I wanted to welcome you together with Elizabeth Ashburn, our Executive Director, and the entire PQMD to today's event. PQMD is a global alliance of international NGOs and leading healthcare companies that are committed to advancing the role of quality product donations worldwide. We have 42 members and we were founded in 1999. Our work is guided by 5 pillars: humanitarian assistance, health system strengthening, disaster response and preparedness, guidelines, and knowledge management. Very quickly, I just wanted to review a couple housekeeping rules. So go ahead and warm up your fingers. We'd love to hear from you. Please open the chat box and type your name and your organization in the chat box so we know who's out there. Because the audience is so large and the format of the webinar is quite concise, all participants have been muted and the videos are disabled. You'll see the panelists' videos illuminated for each panel. We do invite you to use the chat box to ask any direct questions of the panelists or questions in general, and we will curate select responses to these from the group and post them on PQMD's Community of Practice after the event. I'll share that link in the chat box as well. And lastly, we're recording this session so that you might be able to share it with people in the future. Now I have the privilege of introducing our moderator for this session, Jeff Richardson. In fact, he's a longtime advisor to PQMD, and those of you who know him might agree that he's a humble public health champion. Retired now, Jeff is well respected for his leadership as the former vice president for both the AbbVie Foundation and Abbott Fund. He's managed global health initiatives for Burson Marsteller, and his volunteering at GMHC, which is the largest AIDS service organization, had led to his role eventually as the executive director. He spent 4 years in public service with the Indiana state government, driving a complex departmental consolidation effort that resulted in better service for more people. Jeff has woven quite a unique path through public, private, and nonprofit sectors, all while leading change. His distinguished career is full of great examples. One that I'd like to share with you today was his nimble approach in managing at the Abbott Fund's Tanzania project. The project started as a targeted program for children and families impacted by HIV and AIDS. And then Jeff and the team expanded the vision of the program with the goal of providing quality health care. And that project evolved into a major health systems modernization program, including innovative investments into invisible needs such as IT, communications, and of course, giving due attention to the WASH infrastructure. So Jeff, you make an ideal moderator, and it's been a pleasure to work with you in this way. We're looking forward to today's session, and with that, I hand you the conch.
Thank you so much, Julie Marie. To you, it's been a pleasure working with you and the PQMD team. So the vision, the panel number 1 today is the vision where WASH fits into the landscape of healthcare. And the objective of this particular panel is basically, I want to acknowledge at the front end that we know that virtually all of you in this audience this morning are sophisticated global health professionals. Therefore, you understand the need for WASH in the healthcare facilities in order to achieve major global health objectives, particularly those related to maternal, newborn, and child health, health system strengthening, and antimicrobial resistance. This distinguished panel wants to underscore while the absence of WASH in healthcare facilities is a long-standing challenge, it is in fact a solvable problem. The panel will share insights on their organization's successes and challenges that will ideally result in several of our viewers of this morning's program to be inspired to seek additional information about how best to adopt or expand WASH as one of their priorities in their global health programs. So I'm going to start with the questions now for the panelists, and I'm going to move quite quickly because there's so many great people on this panel, and I want to make sure they have enough time to answer questions and share their insights. You've all had a chance to read their bios, so let's just move on to the questions. Dr. Alma Golden. Welcome, Alma. Was interesting to learn that for 10 years, you worked on the front lines in South and East rural Texas in community clinics, including one in Woodville, Texas, where they had no sinks and no water. You had to go to the back of the local courthouse to retrieve water. It helped you understand that clean water and sanitation is truly a global issue, including right here in the US. So my first question is, USAID has many programs to address clean water and proper sanitation, including the Maternal Child Survivor Program, also known as MCSP, the Global Water Strategy Program from the Water Act of 2014, and your new partner initiative. We only have time to cover one of these briefly today, so let me ask you about the Clean Clinics approach, which is part of the Maternal Child Survivor Program. How do you work with the Ministry's Health to develop criteria in their healthcare facilities so you can attain clean clinic status? And what role does WASH play in this process? And what is working and where do challenges remain? Thank you.
Thank you so much. It's an honor to be here, first of all. So I want to thank PQMD for inviting me to speak. Certainly, we have had a number of different initiatives over a long time in terms of WASH, but I think indeed one of the most successful has been the Clean Clinic initiative. It's been an exciting thing because it has not only addressed what happens on the ground in the facilities, but it also amplifies what the concerns are all the way to the Ministry of Health and beyond. It also strives to sort of collect different donors and other interest groups who are participating. And let me just use as an example something that the Hilton Foundation has done along with USAID in Uganda. We have a program there that has been going on that actually also sort of facilitates the private sector and the local capacities. We've with the Hilton Foundation and the CDC, we've looked at actually implementing wash stations, even the temporary wash stations, around different health facilities and other locations. It uses some of the locally procured wash stations and other things like the ways to get rid of sharps and also medical waste. So that's one example. One of the best things that we see in the Clean Clinic initiative is it actually is incremental like that. We look at how to address immediate needs right now, whether it's even with a temporary way to be sure we secure a safe and drinking water, water that's available for just a basic wash, some basic sanitation. But it then builds standards that allows the facility to be able to address how well they're doing and then compare to other organizations and other facilities in the area. And there are even ways that they can almost kind of compete for high scores and potentially even recognition on that. All of this builds from the ground up, but at the same time, we do work with the Ministries of Health to be sure that we help to inform them around regulations, guidelines, and even encourage things like having more water-focused individuals to address healthcare needs. We recognize that in some of these environments, the leadership is a physician, which is fine. I'm a pediatrician. I obviously support physician leadership in environments like this, but we recognize that there are also leaders that need to be there that actually address the broader issues, including WASH. So that's I could go on, but I will let you ask another question or further about that. Thank you, Jeff.
Thank you so much. Alma, just a quick follow-up question. So what is the relationship or working relationship with the Hilton Foundation? I mean, you talk a lot about private-public partnerships. I know you have several people that work specifically on that area, but how critical it is for you to work with partners like the Hilton Foundation on the ground?
Well, I think that particular partnership, along with really very many others that USAID is privileged to have, really is the bridge between making a short-term intervention in a country and developing a long-term sustainable framework. What we've recognized, particularly under the leadership of Mark Green, who left USAID, in March, Mark had this beautiful way of focusing on the fact that we needed to help the countries have a journey to self-reliance. And in that framework, there was a clear recognition that development of the economy, development of the local capacity, development of the commitment of people in communities and governments was essential to really helping to stabilize the environments that they're in. And so when we collaborate with Hilton or any of dozens of other entities around the globe, it really does just create a fabric that allows not only philanthropy, it allows economic development and capacity building. So we are incredibly indebted to them, and it's really foundational to what we see as our new partnership initiative too. The fact that if we're going to build local sustainability, and if we're going to be able to let the people of a country actually manage their own problems and address their citizens' needs, these are all pieces of that good advance on the journey to self-reliance.
Thank you so much. Abraham Ashmer, welcome Abraham from Ethiopia. So we're so happy to see you today. It was interesting to learn that your tireless and relentless quest to build WASH programs in Ethiopia that you started as a young professional in 2007 as the sole staff member, and a year later you were able to add a few more staff and a few more dollars. Every step of the way, as you told me, year after year was often challenging, but you persevered. When you recently left World Vision to run SIF's water programs, you left the World Vision water program with 117 staff and a $24 million budget. In addition, you took variations of your model WASH program to Rwanda, Uganda, Tanzania, Burundi, and provided consultation to programs in South Sudan and Kenya. So that's quite a legacy, and congratulations on that. So Abraham, what were the main components of your program in Ethiopia that allowed it to be so successful and replicated in these other countries that I just mentioned?
Thank you, Jeff, and thank you, PQMD, for inviting me to speak at this webinar. Yeah, I'm happy that my ex-World Vision colleagues are also part of this webinar. Yes, as you mentioned, I was the only person to establish the WASH program for World Vision Ethiopia in 2007. And I've gone a long way. By the time when I left World Vision 6 months ago, we managed to reach to 170 staff, and with annual portfolio of around 24 million. So, one thing which I learned, over the years in terms of, establishing a WASH program is we need to understand, the context where, we are designing and implementing a WASH program. To whom are we, designing that program? Are they, part of, the entire process from A to Z? So these are, some of, the major components. But to do all these things, we need to have a vision. We need to have a strategy, and everything has to be led, based on vision and strategy. Otherwise, we don't know where to start, and we don't know where to end. So everything that we have been doing over the years was based on vision and strategy. And the vision and the strategy was not, something that we developed alone. The community and the government and other, partners within the WASH sector and even from health have been, part of that strategy development, which served as actually as a roadmap for everything that we did over the years. So there are a lot of things that we considered when we develop, the strategy and our WASH programs. It has to be transformative, and as I mentioned, it has to consider the context. The context may vary, from here and there. For example, Ethiopia, it's a big country with a very, very diverse context. So, the program that we have been developing, of course, is a live document that we have been updating year after year. It considers all those diverse contexts within the country. At the same time, what are the potentials within those areas? What are the different challenges, both in terms of water, in terms of sanitation, in terms of hygiene? Because water, when we say wash, is at least has got those three major components. And what is the technology solution? What's the tool, the approach that we have to utilize to address those challenges? So these are some of the things that we have been considering when we design our program. At the same time, we have been also considering the operation and maintenance, even starting when we choose the technology solution. We have been considering all this because at the end of the day, if the system that we built in a given area is not operational, or if it is not sustainable, then that's another challenge. And we have to consider the operation and maintenance from the outset. And we should have also a sustainability plan, by the time when we design the program. So these are some of the things that we have been considering, and something probably unique, which helped us a lot to be successful is Reimagine has got, most of the donors has got a long-term commitment. And that was very, very instrumental for us to be successful. And we have been guided with a business plan. We have a 5 years business plan that was, serving as an instrument, and I think that was also another, very helpful thing that we used, and which makes us successful.
Thank you. And I know that one of your donors is SIF, where you are now working, and so that is clearly a good relationship with them, and other donors have made a huge difference. How much of the success? I know a lot of the front end work was by you and your colleagues, but how have the donors helped lift up the program from where you started in 2007 to where you are today? How would you characterize the significance of the donors and the partners' role in your success?
Of course, the partners and the donors have got a huge support, and of course footprint in our programs, because the long-term commitment, which I already mentioned, is very, very helpful, because we used to design emergency response programs. Usually it's like, for 3 months or 6 months. And usually they are focused on water tracking, just for life saving. But the programs that we have been working on are, these are development projects that considers, a long-term, long-term development that changes, which has got, a huge impact on health and overall, socio-economy of, the community that we serve. So I think that's one thing. Probably, with of course, when I joined SIF, yeah, that's completely a different, perspective. Of course, some of the things that we have been doing in Reimagine, both as an organization and as an individual, that helped a lot. Of course, for me to join SIF, and at the same time for Reimagine also to work with SIF. So for me, that helped a lot because, as I mentioned, the program has grown significantly from just 1% to 170, and it has got a very, very solid team which can deliver, not only just delivering up to the standard, delivering within the time frame, delivering within the budget. So that's something which gives safe confidence to work with World Vision, and of course for me to join SAFE as well.
Great, thank you so much. That's very helpful. Carmen Villar, thank you. Welcome, Carmen. It was interesting to learn of your time as a student intern in 1995-96, working as a social worker in AIDS hospices in San Francisco before there were any effective HIV medicines available. You were able to see the very beginnings of the strategic planning in late 96 on how best to get some of these new drugs out the door. Sadly, many more thousands would die during this time and for years to come, both in the US and abroad. This inspired you to work with the CDC and more recently with Merck. So my first question is, you became a major key influencer at the CDC when you worked in the director's office as the chief of staff for the last 7 years of your 20-year tenure. You now have access to the most senior people at Merck. You have shared that education, communication, and advocacy are key components of advancing any successful program in the private, not-for-profit, or public sectors. How would you suggest to this audience today how best they could encourage their companies and or their foundations to use these principles to embrace WASH?
Yeah. Well, thank you, Jeff, and thanks to PQMD and everyone on this call today. Long-standing partnership between Merck and PQMD, and also some of the other partners I see on the chat, MAP and others working with our medical outreach program for disasters. So I want to say thank you, first and foremost, for having me to discuss this important issue. It's interesting. I wouldn't say that prior to 2 years ago, Merck would have identified WASH as a priority in terms of some of its efforts globally that it works on. And if you ask people now, they may still say that it's not a priority. However, for the company to require and rely on so much water usage to maintain clean and sterile environments for manufacturing, for example, our vaccines, that's a very important piece of maintaining quality vaccines and being able to produce quality vaccines for the world. We have to have a sterile environment, and our water usage can be quite high. I think that's something that we take for granted and not realizing that not everybody has the access that we as a manufacturer do. And so I think that really reminding people of that at every level is key. And I've tried to do that. And as we have seen in our Merck for Mothers program, for example, it's nice to have Alma on the call with us from USAID because we do a lot of collaboration with USAID. And in fact, have recently entered into some work around sepsis and maternal mortality, and the two, how they're related, and really with WHO and support from USAID, trying to look at how we can better address this with WASH interventions, because we know access to clean and safe water in a clinical setting is not always easy to come by in some settings. So I really think that it's important to elevate these discussions at every level. And even, we all know this, but even when our focus might be maternal mortality, or it may be something else that we're working on, WASH plays a key and integral component of being able to provide those services or those interventions. I think that COVID has brought to light for us, this basic thing that many people have taken for granted around being able to wash your hands. If you don't have clean or running water, you can't really do that. And so we talk about higher, at least in the US, we've been talking about higher rates of infection among disaffected communities or communities in poorer settings. And we have to remember that also in the US, we have neighborhoods where they don't, as we heard from Alma's experience in Texas, where there is no access to running water. And I think it's something that a lot of leaders take for granted at certain points. I'm not saying all the time or that we're ignorant, but we as advocates and as leaders in this realm have to remind everyone that at the core of everything we do, there needs to be a WASH pillar or a WASH component to make sure that we are looking at all of the systems involved, all of the partners involved. We couldn't do this work without each other, without the USAIDs of the world and the Hilton Foundations of the world. And we know that, but we also, are we talking to the climate change advocates when we're thinking about how water is becoming more contaminated or polluted, our environmental health specialists that we often don't think about so much when we're talking about public health issues. I think there's a lot of partnership and collaboration there that in the WASH space, but in much of our global health work, has really been untapped in terms of how we can better work together. I would say even today, if I look at all the participants, which is a great list of folks, but not as many from the private sector. So not only working across sectors, but working across interests within those sectors, I think is really important and where we can do better. We know that WASH is critical for everything we do. We know that, but it doesn't always make the top of the priority list. And as leaders, we need to remind people across all sectors that this is key to what we do and how we perform.
Oh, thank you, Carmen. I think when we talk too, it's, I think you said it's not just necessarily even being on the top of the list, but being on the priority list. So it could be your second or third, yeah, but that is molded into and baked into your existing program. So thank you so much.
Yeah.
Peter, Peter, welcome. Peter has been on the front lines working to advance global health and poverty for more than 30 years. Peter was inspired to get into global health and development from his experience in the Peace Corps in Mali. It was interesting to learn that years later, when he was working with SAVE in Mali, he wrote a piece entitled Confessions of a Development Cowboy, Education for All. We crossed paths several times, both of us, while we were working for HIV/AIDS programs in Africa. And as president and CEO of the Hilton Foundation, Peter has carried on its legacy of long support for WASH programs, now 30 years strong. That's quite remarkable. It might be one of the longest programmatic commitments to any one program among any international foundation. So Peter, you described the Hilton Foundation's journey in WASH from boreholes to systems and share many lessons learned along the way as you've grown and enhanced the programs you have helped develop and support. While there have certainly been challenges, why is WASH still a priority program at Hilton for 30 years now and counting? Why isn't it a priority for other foundations? Thank you, Peter.
Thanks, Jeff. You know, and I want to echo what Abraham said about this being a long haul issue. And the more that various actors are willing to take that lens, the more successful we will be. As Jeff said, Hilton got involved in WASH 30 years ago. We did it with World Vision, as Abraham was describing. It was a chance encounter, but it led to them becoming the largest NGO working in WASH in the world. We're tremendously proud of the growth that they have made and all the service they have done for folks. I think we've learned, though, over the time that we have funded, that we started with, as Jeff said, a wells and boreholes approach. If you're familiar with the American story of Johnny Appleseed, we came into a community, we drilled a well, we left. And in many, many cases, the benefit that we helped bring did not last. So over the last 10 years, we've been getting much more into systems and to district water management, which is more complicated, less sexy, less countable, but I think very important both for sustainability and for affordability and for access to the most vulnerable. As a part of that, we have also worked on WASH in healthcare facilities, and with a particular emphasis in Mali and in Niger. And I'd say, you know, COVID for us is an opportunity for everyone on this call to push the WASH in healthcare facility agenda. and we should use that opportunity. But we should also just say it is good health care to have good water in every facility. In fact, it's both scandalous and illogical that we should have so many healthcare facilities in the world that do not have access to clean water. And as Jeff said earlier, it's a solvable problem. It's a pretty straightforward fix when you look at the range of global development problems. It can be approached systematically. Relatively speaking, it's not costly. The governance and ownership of the problem is pretty straightforward. So I would say this should be a real push from the people on the call, but more importantly, from people in your networks where it's not a prominent issue. And one of the things that I'd like to emphasize what everyone said about partnerships earlier. We're talking about the financing of a slice of a sustainable development goal. So this is not a $1 trillion agenda as we often hear about individual SDGs, but it is too large for individual organizations to do. And I think that's why we hear every speaker on this call, and probably most in the audience, thinking multi-stakeholder partnerships are really the way to go on this. And I like to think of this as every partner in a multi-stakeholder partnership having a different superpower, if you like. Government is essential here, and at two levels at least. The national government that sets policy and the local government that carries it out and enforces it and oversees it. Civil society and communities work on demand and oversight and make sure that the most vulnerable have access to the services. And those two levels together, government and civil society, are the best guarantee of sustainability. You can have all the SIFs and Hilton Foundations and USAIDs that you like. If their funding is not carried on by government and participated in and overseen by communities, it will not continue. And about the private sector, I would echo what Carmen said. And I'd say, pharma has shown up in a big way in global health. There are many companies that are water involved and use water in their commercial processes that are not yet involved in safe drinking water or in water in healthcare facilities. Think of breweries, think of Coca-Cola. They have tremendous distribution networks and could be wonderful partners in this work. I would say two more things. One, we need more political savvy. If this is such a slam dunk, if it's affordable, why ain't it happening? So I think we need to have a real analysis of why action is not being taken and how to push this up on the scale of priorities. What it can be linked to beyond COVID. Think of universal healthcare, think of the health SDG. I think there needs to be a real clear explanation of cost and benefit. Not only how much it costs and relatively how affordable it is, but how the benefits will far outweigh the cost and how it can be financed. Those are essential parts of making a convincing argument. And I think we need some process savvy as well. We need to go back and understand how it is that healthcare facilities were actually constructed without having safe water available there. What was the procedural error there? What was the thinking that led to that? And how can we change procedures, change oversight, and just establish the principle that that should not happen? Thanks.
That was great. Now we're going to go through a kind of a, wouldn't call it a lightning round, but shorter answers for the second questions. And so back to Alma. Alma, tell us a bit more about your vision to have USAID Bureau of Global Health play a more significant role in convening, coordinating, and engaging key stakeholders in developing and implementing WASH and related programs in the private, not-for-profit, and public sectors in the months and years ahead, especially in light of COVID. Alma?
Thank you so much. First of all, I want to reflect on something that Peter just said. He was talking about that in some regards, this is a slice of an SDG, and but yet, even though it can be seen that way, it's actually the foundation of so many of the efforts that we have in front of us. As you correctly identified, it is an access to care issue, and certainly an access to quality issue. We recognize that if we don't get this right, then we're not going to be able to address infection prevention control and our safety, like you indicated, for our mothers and babies. We're not going to be able to control the antimicrobial resistance issues that are such a plague to us right now, and to which obviously our pharmaceutical partners and collaborators are so focused on. And then the other issue really is trust. If we don't get this right, it's reasonable that people would not trust going to a healthcare center. And I think we've seen some of how that's magnified during the COVID, even in terms of the when people found out that there was an infectious disease that they could be threatened by, and they realized that all of these things like washing hands and having appropriate masks were important. If they knew that their healthcare provider didn't have access to those things, it was reasonable that they wouldn't have confidence going in. So we really see that as a critical component. Now to the next part of the concept, and that is, what do we do to help our stakeholders stay engaged? One day, a few months ago, I was riding in a taxi, and the young man that was driving was from Western Africa, and he started describing how he and another friend of his, who's also a taxi driver, saved money every month. They put back like $400 every month, and they went together back to their home villages and built wells themselves out of their own money. And it really helped me recognize what a universal recognition it is that water, clean water, is so critical. And we have every category of philanthropists, I guess you would say, in that regard. We do have the individuals. We have a lot of the NGOs. There are clearly many, many faith-based groups that are very engaged in this. There are foundations that even if it's not their focus, they care about it and they contribute. And then, of course, the wonderful opportunities we have from our corporate partners as well, who recognize that clean water is essential. One of the thoughts that I've had as we've worked on this new partnership initiative is, how can we create a new pattern of aligning where we really recognize where the gaps are, where our potential for coordination is. I think a lot of that's already there, but I think this COVID's kind of brought into acute relief how important it is for us to actually not only do our individual activities, but maybe leverage each other. So that's something that's been on my mind. I've shared it with a number of people here in USAID, and certainly with Jennifer Mack, who is so engaged from our Water Leadership Council. I think we all see that this is almost a pivotal time. It's almost a leverage time, because COVID has created an opportunity from that perspective for us to see how important it is for us to work together. So thank you very much for asking, Jeff.
Well, thanks, Alman. And definitely COVID has our attention. Abraham, we don't have time to go into your new program that you're working on now in 10 health districts in Ethiopia with SIF, working with 318 health clinics and 455 schools to roll out programs focused on wash, sanitation, and increasing solar power. But just briefly, if you could say, this is just yet another one of the successful programs that you're working on. Can you let the audience know that, in your opinion, what you're doing in Ethiopia, should they have confidence that these same kinds of programs can be replicated if they decide to sign up as a donor? Or as a partner, can these be easily replicated with the models that you created, or do they have to start from scratch?
Thank you, Jeff. Yeah, my straightforward answer is yes, it is possible to replicate. But before saying that, let me say just few points very, very briefly. As per the GMP 2019 report, 23% of healthcare facilities have got access to sanitation facilities, and 51% has got access to safe water. And the same report also indicates that by 2022 we need to reach 60%, and by 2018. By 2025, 80%, and 100% by 2030. This is wonderful, as a target, but what are we doing practically? Where are we now? Are we, tracking, some of the things that we are doing? I think, we need to keep our words, and we need to move forward. Otherwise, all these things will just remain on the paper. So as a practical action, SIF is, working with the Ethiopian government, World Vision, and other, academic and research partners. And we are designing a wash and electrification program that addresses the water, sanitation, and hygiene and electrification challenge for 318 healthcare facilities located in 10 districts, located in 8 regions of the country. And at the same time, there are 455 schools in these 10 districts. Based on the baseline survey that we conducted, currently the water supply coverage for these districts are at 30%, and our plan is to raise the coverage to 100%. And we are working with the Ethiopian government, and the Ethiopian government is contributing 50-50 with SIF as a co-funding, and that's the kind of program that we are working. And one thing which I would like to say at the end is based on evidences, the gap on the wash, and of course, as electrification, access to healthcare facilities is huge. If I tell you, the figure, it's shocking, to be honest. So using this opportunity, I just want to say, I just want to welcome you all to join hands for a practical action to fix this problem that helps to transform healthcare services. Thank you.
Thank you, Abraham. So moving quickly to Carmen. Carmen, we've only got a couple minutes left for you and Peter for your last questions, but Merck has been a leader. You mentioned Merck for Mothers, and also in the fight against AIDS, you were the driving force behind the Accelerating Access Initiative. And so I just want to cut to the chase here and ask you, do you think companies or other stakeholders should consider coming together once again in a coordinated, focused effort to fight COVID or other infectious diseases, and having one of the initiative's major components be WASH? Is this the time, the COVID time, that we can get people's attention and maybe do something more formal rather than one-offs?
Sure. I want to just say 2 quick things. I know we're running short on time. Just to, I think this is the time, as Peter mentioned. COVID presents us with an opportunity, and unfortunately, it has highlighted or elevated some of the issues that we're not very good at. And this is one where we could do better. And so, what I'd like to say is that advocacy here, and Peter also touched on this in terms of our sophistication here. Advocacy could be better, right? When I was at CDC, we had some of the best scientists and the best staff and the most compassionate staff, passionate staff working on WASH. And it was fantastic to hear some of the stories and the accomplishments and things that they had lived through. But every year when we went to the Hill, WASH was not a priority. Monies coming from Congress were not a priority. And so how do we elevate that discussion? And I think this partnership, or this time to come together, could very well be an opportunity to do that. So I would say yes to your question. I also would say that this group serving as connectors is really critical as we think about this strategy going forward and this advocacy going forward. At Merck, I was surprised when I joined a couple years ago to learn that we have 140 subsidiaries in 140 countries. How do we make those connections on the ground? To someone's point earlier around the sustainability with the local government. I know that my offices there are talking to ministries of health, but are they also talking to all of you who might have a presence there? Are they also working in that collaborative fashion to really address some of these systems issues in our healthcare system? So I would just say that as my last 2 points, and thanks again, Jeff, and to everybody.
Thank you. Well, Peter, we're going to come to you now to wrap it up. I just want to say to the audience and to the panel, we may go a couple minutes over, but this is the last speaker. And we could, incidentally, we could have interviewed any one of these single people and done a one-on-one interview with them and filled up the 45 minutes. So this is an amazing panel. We're so lucky to have all of you on this panel. So Peter, you heard this over and over, but a key challenge to building a foundation of WASH, or frankly any program, is financing. People say, oh, this sounds like another do-good program. Yeah, this sounds nice, but does it really have a return on investment? Does it really, is it something that's sustainable? And you folks have actually done work in this regard, and you have something specifically to say about that an investment in WASH is indeed a sound investment. So could you talk a little bit about that, and then maybe give us a closing thought as we say goodbye to our audience? Thanks, Peter.
Sure, and I'll thanks, Jeff. I'll try to be brief as well. I think eminently, this is great because we can talk about what are the unit costs. We know those. What are the costs to bring WASH in? We can talk about what are the outcomes. Alma went over a lot of them, right? And you can measure those locally. What is the difference in infection rates? What is the difference in safe deliveries, et cetera? And you can do those nationally. I think this is a compact package that we can deliver on. And I'm actually quite heartened by this call. All of the different ideas, the different organizations, we just need to get our act as together as we can. But I think we can definitely deliver on the costs outweighing the benefits, and the financeability of this being actually pretty straightforward. Thanks.
Great. Well, thank you, panel members, for your thoughtful and insightful comments. I know you're all committed to advancing WASH programs clearly, and would be willing to be connected with interested audience members in the weeks ahead. PQMD will facilitate those connections. And thank you, audience members, for your time and interest, and of course to PQMD for hosting this. So I'd like now to turn it over to Julie Marie and the PQMD staff. Thank you so much, everybody.
Thank you, Jeff.
Hello, everybody, and welcome back. Before we get started with the second panel, I just wanted to give our partners in crime in organizing this webinar a chance to talk about their initiative and to talk about ways that the audience members can plug into future events. So it's with great pleasure that I hand over 5 minutes to the Global Water 2020 team, Hank and Lindsay.
Thanks, Julie Marie, and thanks everybody for taking part in this. I had to hesitate a minute when Julie Marie asked me if I'd say a few words. After that first panel, there's really not much, there's no way I can improve on the comments that were made in the first panel. It really did our hearts great, but I do appreciate the chance to introduce our organization, and I have with me Lindsay Denny, who's our public health expert at Global Water 2020. And just in a quick nutshell, Global Water 2020 is a limited term NGO. We're fully funded. And you could say that we really are pro bono consultants to the healthcare and the WASH communities to help bridge the gap, to close the gap of WASH and healthcare. First, to help work with a lot of other organizations to raise the awareness of this gap. And we heard on the first panel really articulately expressed that there's no good reason other than inertia and institutional stovepipe thinking that has kept WASH from being at the place it needs to be in healthcare, and especially low to middle income countries. So we want to do everything we can to support organizations, and that's what we're here to do. So if your organization is considering being a partner in a WASH and healthcare project, or just want to understand it better, we will put contact information in the chat box. And the other thing I'll just ask Lindsay to mention briefly, because next week we also have a webinar. It's a 1-year anniversary of a commitments event where about 100 organizations made commitments to take action related to WASH and healthcare. And we'll be building on this discussion here. And I want to thank PQMD for your leadership in putting this pillar talk together, but also in building this issue into your community of practice, which I find very impressive and we really want to work with. But Lindsay, you want to just say a word about the June 24th event?
Sure. I think it's a great sign of how far we've come I've been working on this issue for 6 years, and we once called this a neglected crisis. And while certainly there is so much more work to be done, I think the fact that Hank and I put together a dream list of speakers and they all said yes for this panel really goes to show how far we've come. So really excited to have all this collaboration on this, and thank you all for joining. As Hank mentioned, we have an event next week which celebrates the 1-year anniversary of commitments made to WASH and healthcare facilities. If you've made a commitment, of course, we'd love you to join, but if this is new to you and you'd like to learn more, please join us. We'll talk about where we've been, where we're going, and what it takes to get there. Celebrating successes, but really diving into the future. So I'll put some information in the chat box, and we hope you can join us. Thanks again, Julie Marie.
Great, thank you very much, you too. And so with that, I think we're ready to start our second of the 2-panel series. So good day for those of you who are just joining us now. We're so glad that you could join us for the PQMD special COVID-19 Pillar Talk webinar series. This event is made possible in part from a generous donation from Pfizer. And PQMD is partnered with Global Water 2020, as you just heard, to dive into a discussion about the overlap of strong WASH infrastructure and health systems resiliency. If you are unfamiliar with PQMD, we invite you to learn more about our global alliance dedicated to excellence in medical product donation through practices and guidance. Our organization represents 42 members, and we bring together the work of nonprofits and the private sector while responding to disasters, strengthening health systems, and addressing disease and sharing best practices. My name is Julie Marie Vanderberg, and on behalf of PQMD, we are so pleased to welcome you, or welcome you back if you joined us for the first panel. Just a real quick reminder that because of the large size of the audience, all participants are muted and the video is disabled. We do invite you to put your name directly into the chat box and with your organization, as well as any questions you might have per panelist. I'll share a link for PQMD's community of practice, and we look forward to continuing the discussion there. And so now I have the pleasure of introducing one of my professional mentors, Veronica Ariave, who will moderate this session. Many of you know the dynamism, thought, and professionalism that she brings to every position, project, and conversation. Veronica currently leads as Baxter's Director of Global Community Relations. She's the Executive Director of the Baxter Foundation as well. Veronica's history with PQMD is deep and varied. She's worked for PQMD, she served as a member rep for a few different organizations, and she also performed sector-wide research focused on the power of the collaborative approach in disaster response. She connected PQMD members in their work directly on the ground in Haiti. She did this as a Global Health Fellow for PQMD. Her experience draws from both nonprofit and corporate positions with organizations such as Johnson & Johnson, Wyeth, MAP International, Project Hope, and USAID's Measure Evaluation Program, among others. Notably, she also served as the Director of Corporate Responsibility and at the AbbVie Foundation from 2014 to 2017. We are so happy that she's our moderator today. With her ability to pull together people and concepts to match needs to resources, her vision in global health, and her current focus on water programs through the Baxter Foundation. And with that, Veronica, we look forward to the session. Thank you.
Thank you. Thank you. What an amazing introduction. I was quite surprised. Thank you for that. And thank you, PQMD, Julie Marie, Hank, Lindsay, and Jeff, I think, for helping us bring these panels to life. I'm really excited. We're thrilled to see so many participate on today's call. Baxter has proudly been a longtime member of PQMD, and we recently adopted WASH as a strategic funding priority area to leverage how we increase access to healthcare. So I think this is a conversation that's very personal to me, and I hope that you're as excited as I am, because we're joined by a panel of highly respected colleagues today. I hope you've had a chance to review their bios. I truly have the honor of leading this discussion for folks that walk on water and WASH panel speakers. So, I think today's objective, as we heard in terms of key things from the earlier panel, is, looking at WASH not being prioritized, right? Few funders have considered it a long haul objective, and that the first panel really explored how COVID-19 has illuminated the importance of WASH as a cross-cutting tenet in healthcare facility planning, and it underpins how we advance the global health agenda. So this panel's objective really is to help us connect key themes, illustrate how to elevate WASH from a vertical approach to a more institutional systems approach, and help illuminate that how by providing examples how to initiate, co-create, and sustain WASH programs. So in the interest of time, let us begin. The goal here is to have 2 rounds of questions, and what I'll do is I'll try and curate and sort of prompt us as we have this discussion. So I'd like to kick off our conversation. So join me in welcoming our panel. And I'd like to kick off this conversation with Murfin. Murfin, like others on the panel and on the call today, React Africa has worked to build partnerships that support large-scale disease-specific initiatives to expand access to health care. So can you help us frame the partnership space for us? From your experience with React Africa, what are the key factors in building long-term, high-impact national action plans and institutionalizing WASH with diverse sectors and regional stakeholders?
Thank you so much, and thanks to the conveners of this webinar. I'll begin by saying that high-level commitments that lead to country policy documents and strategies are often derived from global goals, such as the UN General Assembly or WHO's World Health Assembly or regional bodies. Ensuring access to water and sanitation for all is Sustainable Development Goal number 6. And development of national action plans to address antimicrobial resistance that is responsible for 700,000 deaths a year globally, and that is projected to increase to 10 million a year by 2050, arose from the World Health Assembly resolution in 2015. The challenge, however, with these plans is implementation, as you all know. Moving from paper to action has been a limiting step for most countries. Though there are many factors that lead to lack of implementation, the major one is that these policies and strategies are resource intensive beyond what most LIMC's countries can afford. This creates great opportunities for partnerships with funders, both foreign and local organizations, civil society, NGOs, partners, and academia to collaborate on. As REACT, we've been supporting national governments develop and implement AMR national action plans, and also supporting the regional bodies with high policy documents to support member countries. These includes interventions such as infection prevention and control, where WASH is actually key. And putting these challenges into perspective and the need for partnership, the small action of hand washing can prevent so many infections, so many infectious diseases, but unfortunately 3 billion people around the world do not have hand washing facilities with water, soap, and soap at home. We've got 47% of schools that lack hand washing facilities with water and soap. And this affects 900 million school-age children. And in 16% of health facilities, there's no hand washing facilities in the areas where patients receive care or near the toilets. And so these challenges become actually enormous for most low and middle income countries. So in terms of, what have been some of our key successes and some of our principles that we have used? One of the key elements that is important in partnerships is mutual respect and benefits, recognizing the role of government and partners' role. To respect partner country leadership and help strengthen their capacity to exercise it. As partners, to work with the governments, realize their vision and that of their people, to align analytic, technical, financial support with partners, capacity development objectives and strategies, and also to make effective use of existing capacities and harmonize support for capacity development accordingly. to base their support on partner countries, national development, and health sector strategies and plans. It is important to continue providing the provision of resources that partners provide, investing in health systems, in hospitals, in training institutions, and equally engaging in public health programs like WASH programs. Trust is important also, to be transparent, being able to share the results, and being able to have a common agenda, and ensuring that we manage the results and share them with the governments, because they are part and parcel of actually partners. But also, lastly, to be able to involve communities and local organization in knowledge generation, in synthesis and sharing, and being able to work with communities to actually take the bottom-up approach, which we have found is equally effective. Thank you.
Thank you, Murphin. Thank you. So I'll follow up with Batuke. As country director in Zambia with CMMB, you work with one of the oldest institutions in today's panels, with more than 108 years of delivering health and building partnerships. Can you help us with today thinking through, with the understanding that water is vital in improving women and children's health and productivity, how and what wisdom does CMMB have to share on what it takes to build water and sanitation as a core tenet of health program delivery?
Thank you very much, Veronica, for this great opportunity and representing CMMB. As you've said, one of the very old organizations that has been dealing with women and children's health, and recognized issues of WASH, and that's one of the 7 pillars that we focus on integrating into women and children's health, with particular interest on maternal neonatal child health. We are working to implement this, our work in 5 countries within what is called the Children and Mothers Partnerships, the CHAMPs. CHAMPs are designed to be partnerships with a hospital, government, mission hospital in rural settings mainly, for a period of 15 to 18 years. And I'll continue from the last presenter in relation to the last statement that said we really need to be looking at engaging communities from bottom up. And that's what we have done in CMMB. So as we are implementing the CHAMPs, we have started, first of all, by designing it with the communities themselves being involved, ensuring that traditional, civic, and community leaders are involved in an assessment to understand the issues and then build upon what we all learn together to suggest interventions that will then deal with the issues. So when we're talking about the issues around WASH, it's those that the community members themselves have realized. For example, access has been a major problem, access to water, the drilling of boreholes in some places, there's salty water and that sort of thing. So that's what we have tried to do. We have responded to the issues based on what we find on the ground and working through those together with the communities. Using an ecological framework and approach, dealing with the individual and the community members, harnessing community engagement with volunteers, training them as community health workers, working with the health facility within the national level guidance, ensuring that whatever that we're doing is built within the national systems and structures so that they can be monitored, even beyond the 15 to 18 years that we would be working in those particular areas. In particular, we're working in an area called Mwandi, working with the mission hospital there, covering a population of about 40,000 individuals, ensuring that the volunteers are going door to door, distributing water purifying sachets to ensure that the water that they are drinking is clean, it's safe, ensuring that access itself, drilling boreholes. And this has been interesting because in rural settings, especially, it's mainly hand pumps. And so we have found that when we have mechanized the system, it has not only been extremely appreciated, but we believe that this will be part of our contribution towards improving on WASH within the health facility itself, especially in relation to the women that need water so desperately when they go to access health services for the children as well as the women themselves. We have also, with the community volunteers, implemented sensitization at household level as well as community level, so that hand washing tools and buckets and dishes they are made available, and we don't always pay for everything. We just make the communities understand the importance of them setting aside some of their household income to procure dishes, for example, dish racks for their plates after they've finished washing them. Making sure that they have a rubbish pit. And the community volunteers are checking each and every household to make sure that waste is managed in such a way that there's good hygiene in the villages. It's amazing how simple activities such as just avoiding and sensitizing communities to avoid open defecation, building of pit latrines, and encouraging themselves to ensure that they use their own resources to implement those activities. We believe that this is a major approach that goes towards building ownership. It ensures that whatever that we're doing with the communities, they see the benefit of. And so the interventions are sustained by the community volunteers. They are sustained by the community members themselves at household level within the community, and ultimately contributing to issues around morbidity and mortality at national level. At national level, we continue to participate in the various national technical working groups, contributing towards the various policies and guidelines that are being developed, including those that towards, action plans and that kind of thing, so that we make sure that health facilities are able to have water, ensure sanitation, and so on and so forth. I think in a nutshell, that's what I would share for now.
Thank you, thank you. So I appreciate that. I think we'll definitely come back to a couple of those topics in the second round. So I'll proceed with you, Dr. Zach, and you've worked tirelessly on maternal health and child care issues across the globe to champion global health. And you've operated on several sides of the social sort of impact equation, wearing sort of different hats, going from doctor to programmatic unit chief. So if you could sort of build on what Murphan and Batuke have highlighted, can you share how Unicef is implementing and leveraging WASH into country implementation agendas?
Yeah, I think WASH for UNICEF is a prerequisite of quality of care provision. It's particularly important to ensure that childbirth and newborn care is safe. And building on what Murphan was saying, I think we still have a gap between what has been decided on a global level and how the implementation looks on the ground. But Batuke was also highlighting what they do, and I think we are very much on that same page, being very operational as UNICEF. Health systems are really weak, and I think the lack of WASH is just a symptom of a wider problem. It's the weak, non-resilient health systems that are the problem, and not WASH alone. So WASH is a big part of that, and it's an indicator. I worked 10 years as an OBGYN in several settings, including East Africa for some years. And I remember when I did a cesarean section and I went to the theater, maybe there was a small piece of soap that was already used by many other people, or there was no soap, or there were just a few drops of water coming out of the tap, and we had to get someone to get the bucket and get some new soap. And this is a theater setting for a cesarean section. So if this is the problem that we're facing in theaters, what is the problem outside in the community? So it just shows that there's so much more we have to do on the ground, and the translation from global commitments to the ground are not there, but they're improving as we have more and more countries really being committed. The importance of hand washing is becoming very obvious with COVID-19, and the resilience becomes very evident, and that's, I think, an advantage and an opportunity we have. As UNICEF, our strength is really the country presence. We are known as the UN agencies being very operational on the ground. So we have, we really work on health systems improvement through the quality of care scope. You might have heard that there is a quality of care network that we are part of with WHO and other partners. UNFPA has joined and others. So this is a forum where we see a lot of opportunity to really engage in WASH. And then also, we also ensure that we have functional WASH services, of course, through our country offices, and we support governments, and we have great partnerships like with Water 2020 and others that are really translating into implementation on the ground. Just to highlight also, we had launched a few weeks ago a campaign called #Reimagine. This is a child-focused campaign for COVID, an urgent appeal for governments and public donors and private sector to join UNICEF to seek and respond to reimagine a world without COVID, and WASH is a very big component of that. Just to close, I think the solutions, well, they are not solutions as such, but things that I could see as we move forward that are important is, first of all, we need to realize that healthcare, that WASH is an enabler for health system. It's a force multiplier for health system improvement. And COVID is a great opportunity for us to bring this up. Now, everyone talks about hand washing around the globe. Let's use that as a momentum. We also need cultural change. We already have cultural change. When we look at ourselves now communicating over Zoom, wouldn't have been possible before. So let's use that culture change in the community to get hand washing and WASH out there. We have to work across sectors. It's not health alone. It's not education alone. It's so many sectors that have to take WASH on. And then also we need simply more practical steps. COVID will not be the only pandemic that we're going to face in the future. So let's make sure that we build back better and that we are more resilient.
Okay. Thank you. Thank you. Well, I appreciate I love the force multiplier for healthcare. I think WASH is definitely one of those components that I think can be leveraged as a cross-cutting implementation strategy. So I'll move on to our next panelist, Dr. Barrasso. And so John, as a maternal, newborn, and child health specialist with the Global Financing Facility, you also work with the World Bank, which is playing a major role in the response to the COVID pandemic. If you could share with us where you've seen WASH in healthcare facilities addressed as part of the programmatic response, and maybe you can illuminate a little bit for us, sort of how COVID is playing into that. Thank you.
All right, thank you very much, Veronica. I've never been part of a panel that was described as walking on water before, so this is a real challenge. So just first, a little bit of background about the Global Financing Facility for Women, Children, and Adolescents. It's both a partnership of donors and UN agencies, the World Bank, private sector, a number of private sector partners, as well as CSOs, NGOs. So many of the players that are probably represented in this call have some connection to one of those constituencies or another. It's also a financing mechanism, and as the GFF has mobilized so far about $1.6 billion in funding to be devoted to what's been called improving both systems outcomes that relate to RMN, CAH, and nutrition, which is reproductive, maternal, newborn, child, and adolescent health and nutrition, as well as ensuring a sustainable financing platform for those for the moving on out as into the foreseeable future. So that's the fundamentals of the GFF. The World Bank, as Veronica mentioned, played a major role in the COVID response, and to date has launched COVID activities with partner governments in over 100 countries. The initial response started at the end of March, and the initial response was very much focused on some very COVID-specific issues. Establishing intensive care units or trying to ensure adequate PPE, very specific to the units that were responsible for COVID response. However, as time has gone on and the GFF started also to highlight for everyone, including its own investors, that the secondary threat posed by COVID, just because of the impacts on the access to and utilization of essential services for, again, that whole alphabet soup of RMNCAH, really risks setting us back significantly. And that was setting us back on key issues such as skilled birth attendance, setting us back on key interventions like immunization, with consequences for child and maternal mortality that would set us back several years in terms of the gains that have been consistently part of our recent experience in public health. There's been a number of models that are out there that have tried to look at this issue. I don't think that the models themselves are necessarily giving us answers, and they're not necessarily predicting the future, but they're meant to inform us. How do we actually take action? So one of the things that's been apparent as countries now have been engaging with the bank and with the GFF is that the issue of the threats of discontinuity and setbacks in essential services is actually becoming not seen as something that is ancillary to the COVID threat, but it's actually fundamental to the COVID threat. And more recently, projects that are being designed to address COVID, in fact, have taken on this issue of essential service continuity. So how does that relate to then the issue of WASH? Well, I think there's a couple of ways, and I think Will stated them very well. One was WASH is both a symptom of and WASH in healthcare facilities. The absence or the shortcomings of WASH in healthcare facilities is both a symptom of and part of the manifestation of weak health systems. And then also it relates very directly to the quality of care agenda. And all of this was there before COVID. I mean, one of the things that COVID has done for us as a global public health community is simply amplify and heighten our awareness of these key weaknesses. Because we know that it was important for quality of care, as Will had said. It's also fundamentally important for respectful care. We know that shortcomings of sanitation is a real problem in terms of just the respect afforded to patients in facilities. And then as a subset of quality of care relates very specifically to infection prevention and control. So there's two ways in which this has been, WASH in healthcare facilities is now very fundamental to this continuity agenda. One is it's very important on the demand side. Patients will not seek to go to facilities where they perceive a risk of infection. And the second, it's important on the supply side. If your healthcare workers are not adequately protected from infection, then your health workforce will suffer, and the facilities the ability of facilities to deliver services will suffer. WASH in healthcare facilities is part of a broader IPC agenda. Is a complement to the work that has to be done around universal availability of personal protective equipment, PPE, as well as some of what's been termed more broadly now risk communication and community engagement to make sure communities are aware that they can get safe and reliable services in facilities. Most recently, I've personally been involved in a project that's being prepared with the government of Zambia that is one of the ones that has explicitly included all of these components as part of support for essential service continuity. And I have a few other thoughts, but I think they'll be more appropriate for our second round. So I'll just hold off for there. Thanks.
Thank you. Thank you. We'll break into round two, but I kind of want to just highlight a few things that I think we all heard in terms of key themes. COVID has heightened the importance of WASH. We've looked at the quality of care and how it impacts the frontline healthcare workers and indeed the quality of care that's delivered. We've seen that the importance of harnessing community health workers, the importance of working with national health structures, with communities, with being part of a network, the importance of trust, the power of partnership, and some of the cross-sectoral partnerships necessary to advance a common agenda. So I think, as we listen for those key themes, in terms of round two, what I really want you each to provide for us and for the audience is to really help us, it's the how, right? And highlighting collaborations that required coalition building, that have remained sustainable and what and how has COVID changed and or, highlighted or heightened the importance, which we already heard. So, as we look at this round 2 of questions, let me circle maybe back to you, Murfin. We've heard from our panelists the importance, and could you put WASH and COVID in context for us in terms of the audience? In other words, how has COVID heightened the importance of WASH, and can you provide a couple of examples from your work?
Primarily, I would actually focus on 2 areas. I think the area that has been that we've highlighted is its impact on disease. Safely managed water, sanitation, and hygiene services are really essential part of preventing and protecting human life during infectious disease outbreaks like COVID and other pandemics. One of the most cost-effective strategies certainly is being able to include WASH in pandemic preparedness, in emergency preparedness. It is actually quite key, especially in resource-constrained settings. It's important to continue investing in core public health and infrastructure to actually strengthen health systems. If one looks at WASH and one looks at antimicrobial resistance, which is equally a pandemic, is that both issues are actually systems problems and health systems problems. Good WASH and waste management practices that are consistently applied. They serve as barriers to human transmission of COVID, between actually animal and human transmissions, but also transmissions within homes, communities, and in schools and other public spaces. And when one looks at the impact of WASH actually on SDGs, is that impact is that the gaps in water supply system and poor actually WASH can contribute and affect the success of the other SDGs. And so one looks at the gaps, for example, in access to water supply and sanitation of growing populations, more water-intensive patterns of growth, increasing rainfall variability and pollution are combining in many places to make water one of the greatest risks to economic progress, poverty eradication, and the sustainable development. So WASH is a key component of emergency preparedness, like I have said, and must actually be included in that. When one looks at the health systems, mostly in most African countries where I have worked, I've worked in so many health facilities in many countries, and you would find that in these countries, there's no running water, there's no soap, there's no hand sanitizer, and yet these institutions have to run. And so what we end up happening is actually we end up using more antibiotics, to actually both prevent infection, but also to cure. And that compounds the problem or contributes to antimicrobial resistance. And so I think what actually this pandemic has done is to elevate the issue, but also to have, a coordinated global effort in terms of investments. I think there are a lot of funds that are flowing in low and middle income countries, and it will be up to these countries really to be very strategic and use these funds to strengthen their health systems to address the issues and components of WASH. But also one of the weak areas that I see in most low and middle income countries is that the issues around WASH are not discussed at country level and in communities. And I think COVID has presented us a perfect opportunity to be able to elevate these discussions, to have them on a dinner table, to have them actually in communities, in the district councils, and so that these issues are actually addressed and the problem really is seen for what it is. So actually, there is a great opportunity that we have if only we can latch on it and use, COVID to strengthen our health systems, to strengthen our infrastructure, really in communities and use the investments that is coming into these countries more effectively and responsibly. Thank you.
Thank you, Murph. And I appreciate the thought around elevating WASH to funding agendas, both at, at the community level and national level, global health agendas, and to continue to be a part of the dialogue as we continue to advance UN SDGs above and beyond what's happening at the community level. So thank you for sort of, really thinking through in terms of the elevation of that. Baduke, I'm going to continue with you, and based on Murphin's example and sort of, what you've seen in terms of CMMB, how has CMMB had to innovate to build WASH capacity in the face of COVID? Working obviously with provincial district health offices, how has that process emerged in terms of COVID, and what are you learning from it?
We are working with health facilities, within Lusaka, with the urban area, while also working in the rural areas. In the rural areas, COVID-19 hasn't really hit us that badly. We don't have that many cases, as much as some of the rural areas, border areas, provincial capitals, and that sort of thing. But what we have done now is to really identify that we need to provide support to the health staff, while we're also providing support to the volunteers. So this comes in building their capacity, especially the volunteers, so that when they're going into the households, they have the information that they need to be providing to the household members to ensure that they're maintaining the COVID prevention practice, which, as we are all aware, is fundamentally standing on issues around WASH. So they have to make sure they are washing their hands and so on. And so we've actually integrated COVID-19 practice on everything that we're doing because of the importance of us having to do that. We are also working with the district health officers, ensuring that the training that the volunteers are receiving is that which is mandated or with the guidance of the Ministry of Health, and working with the district health staff. We are also working in the different committees, and what is very interesting is how the different sectors have come together, recognizing that COVID-19 is talking about WASH and taking WASH out of Ministry of Health alone, and taking issues of WASH even into Ministry of Local Government, Ministry of Home Affairs, so that, for example, when getting into Mwandi district, we had to then provide hand washing facilities at the entrance to the district. Fortunately, most of the rural districts, there's one road going in and one road coming out. So then it's easier to just make sure that wash facilities are provided as everybody is getting into a district to prevent COVID-19 from getting into that district. Of course, with all the other tools that are necessary in relation to COVID-19 prevention. I think that it's very important that we continue to appreciate all the different partnerships. CMMB would not be able to do all of this without various support that has come in. The provision of PPEs to the volunteers, as well as the health facility staff, and as well as making sure that the health facilities can provide all the information that is necessary. We have also produced IEC materials that are being placed in different areas so that community members can see immediately what they can do themselves as part of making sure that, there's no COVID-19 spreading, especially in the rural areas. Partially, I think that's what we've done.
Thank you. Well, and I think it's really interesting to see if you reinforce COVID training at the health staff volunteer level and working from the bottom up, I think in terms of working with health districts, Ministry of Health, Ministry of Home Affairs, Ministry of Education, all of the ministries that need to be involved in the integration of a solution and, to combat COVID, I think will be an important way in which we will build preparedness skills and resiliency in the communities, I think, where most of the organizations are working. So thank you for bringing that to light. So Will, based on what Merfin and Batsuke have shared, in your view, how has Unicef built WASH capacity with frontline healthcare workers in rural communities? You know, what has COVID changed? What has COVID added? You know, what nuances can you share that you've seen that COVID has brought to light?
Yeah, you know, the biggest problem is that we have is not that people don't agree that WASH is important. It's more institutionally, you know, there are blind spots that we have that are open and that are left behind. And I believe there's one cadre that can really solve the problem for us, and this is midwives, skilled birth attendants, especially when we talk about maternal newborn health. This is a cadre that is empowered so much during the past years and has gained so much momentum. And this year, 2020, we have the year of the nurse and the midwife. This is a cadre we should incorporate much more in our WASH discussions. You know, as UNICEF, with partners, especially with UNFPA, who are leading the midwifery engagement in the UN, together with WHO, we really recognize that midwives and community midwives play a very important role. They can provide guidance to mothers, and the mothers bring it to the family. They can act as role models for practicing hand washing in healthcare facilities. They can encourage hygiene behaviors that will be brought to the family. They are the link between WASH systems and the healthcare systems and other priorities in the health systems, such as AMR, IPC, maternal newborn health. So, you know, and many of my colleagues, we are very strong believers in midwifery care, and they are being empowered. If you look, for instance, to India recently, where together with UNFPA, the UN has really achieved a lot by empowering midwives and lifting them up to a very real midwifery role. We have to use those roles. And they can also be advocates for greater investment. As John was saying, the GFF and World Bank, how can we convince government and partners to have to do the right investments? And I think midwives are, again, a very good cadre that we should build on. We, with the UNFPA and others, we work very closely with the International Confederation of Midwives on a global level, but also on national level. And we see them really as a standing item in WASH and in health systems, especially when you look at that, you know, look at the fact that 1 in 5 births globally are taking place in low-income countries, that we still have 17 million women in low-income countries giving birth in healthcare facilities. In this COVID situation, we hear a lot of anecdotal evidence that mothers are not able to, pregnant mothers are not able to reach facilities sometimes, or that the facilities are empty, or healthcare workers are reluctant to come to healthcare facilities. And there again, the communication is very important. We don't need protective equipment for every healthcare facilities. A simple intervention such as washing your hands is already sufficient in many cases. And taking away that fear from the midwives, taking away the fear from the healthcare workers is very important. And that's why that communication, open communication with healthcare workers and the community is very important. You know, not to confuse COVID, for instance, with Ebola or with viruses or with pathogens that are really super infectious. So in a nutshell, I think, you know, midwives is something we should really consider to move forward with. And as UNICEF, together with UNFPA and other partners, we will continue to advocate for great investments to ensure that we have functional healthcare facilities with the help of healthcare workers such as midwives.
Thank you, Will. I appreciate that perspective. I think the importance of midwifery continues to be, and community health workers, I think, to be role models and encourage and be sort of the glue that binds both WASH systems, healthcare facility trust, and, you know, I think building trust in communities and for them not to be reluctant to seek healthcare, especially under some very difficult conditions in terms of COVID. So, John, turning to you to sort of close us out and sort of think through what our panelists have shared, sort of bring together, I think, and integrate some of your thoughts around the challenges. You know, obviously we're hearing challenges and opportunities abound. I think in terms of, you know, how can long-term investments in WASH, in your view, leverage cost-cutting investments, and what generative thinking do we need to build country strategies for WASH?
Okay, thanks. Yeah, it's actually been very interesting to listen to everyone on this. I've in my career I've had the opportunity to work in environmental health, water and sanitation, and now maternal and child health. And consistently, even though I've worked in those diverse areas, the ability to actually mobilize funding and actually drive programming around cross-cutting issues that require investments from multiple sectors simultaneously is in fact a really significant challenge. I personally believe that measurement issues are key. I noticed that in the one Q&A we have in the chat box, the Q&A box, somebody asked, well, how do we actually measure this? How do we measure what's going on in facilities? And we actually, it was the joint monitoring program of WHO and Unicef that for the first time tried to systematically look at conditions of water, sanitation, and hygiene. This was data as of, I think, 2017. But we do need to more routinely look at this as really a fundamental component of what we assess in both situational analysis and in programmatic decision making. There are several surveys that could, in fact, provide some of this information. There's the service provisional assessment that's supported by USAID and the part of the DHS program. There's the World Bank Service Delivery Indicator, Service Delivery SDI survey. There's WHO's SARA program, and there's actually been some work now to try to look at how do we better harmonize those various facility assessments. But surveys, really give you lagging information, and we also want, and particularly in the face of a fast-moving public health issue like COVID, to be able to understand where are the problems now, are they being addressed, and what do we get? And I think the measurement issue is a significant one, and an area where potentially some innovation in digital health and being able to better automate how we gather information could be particularly promising. I have no specifics in terms of the ways it's working. I'm just highlighting that some of the innovative thinking that's been going on in digital health solutions that in other parts of the maternal, newborn, child health, reproductive health space could potentially be better leveraged to also support what's going on in facilities. I also would highlight the way it works programmatically, even for the GFF working inside the World Bank. We have part of this discussion around WASH healthcare facilities within the bank. It's been led, really the central point is actually outside of the GFF and the health, nutrition, and population area. It's with the water security and sanitation partnership. That's a similar kind of trust fund within the water practice at the bank. And we've discussed this issue of how do we actually potentially pull together diverse resources to address an issue where the health component may be adequately both resourced and be able to meet the technical and programmatic challenges of some dimensions of this, particularly as they may relate to sanitation and hygiene services in facility. But certainly we know that having an improved water source on premises is really a critical component of making, for example, hygiene work effectively in facilities. And that's a lot of the times that's beyond the scope of what the health sector can traditionally manage. So how do we actually bring those two together specifically? And I propose that one of the things you can measure is that if you actually have adequate water supply and improved water supply on premises within a facility, then it's very likely that those other services that are required, sanitation and hygiene requirements, are also being met. So just to sum it up, I'd say that the measurement issue actually is very critical. Figuring out what indicator could appeal to multiple sectors is actually is an important piece of that. And I think routinely trying to update what we know in a very fast-moving environment is going to be critical to making progress. Thanks.
Thank you, John. And please join me in thanking our panelists. I mean, no matter what side of the equation you sit on, what sector you sit on, and what government, private, nonprofit sector you're on, our panelists, I think, illuminated so many opportunities for us to consider, the nuances and opportunities for us to continue to think about how to incorporate WASH in our thinking, in our funding, in our implementation, and operationalizing so many of those aspects of WASH. So please join me in thanking our panelists. And at this point, I'd like to turn to our PQMD hosts to wrap up our session today. Thank you. Thank you all.
Fantastic. Thank you, Veronica. And thank you to all of our panelists. Your phenomenal leadership and ability to articulate the solutions while integrating foundational WASH infrastructure has really inspired this important dialogue. The gap at a human level has always been clear for people living with limited WASH security. And COVID-19 has certainly exposed the critical nature of these needs, but it's also, as you have said, provided a spotlight of opportunity for a collaborative network of very capable global actors to get it right moving forward. So from our perspective, it's been a very productive 90 minutes, rich well beyond that time with kernels of wisdom, commitments, and implications of action. We look forward to continuing this conversation with Global Water 2020 on our community of practice. You do have to sign up, and it's there in the chat box. Once you do sign up, you can join the discussion and find resources. The first question I'll post is that question about resources for metrics. So on behalf of PQMD, thank you all for being with us today, and thank you for the work that you do in the world that made you gravitate to this event today. Please keep an eye out for our upcoming webinars with interesting topics and incredible global health actors. Goodbye and enjoy the rest of your day. To the panelists, would you mind staying on for 1 minute and illuminating your cameras so that I can just capture a screenshot? And moderators.